Hey, and thanks once again for tuning into our show, Morgellons Disease Discussion and Microscopy Videos. I'm your host, Jeremy Murphy, and today we're very blessed to be joined by special guest, Dr. Greg Smith. Dr. Smith was a retired medical doctor as well as a former fellow of the American Academy of Pediatrics, and he's a specialist in pediatric medicine. Dr. Smith, how are you doing today?
I'm doing fine. It's a great conference here today, and a lot of good information about Morgellons is available now.
So this is an annual conference that is held every year in Texas. What can you tell us about this conference?
Well, we started this foundation, which is now the Charles Holman Foundation, about 12 and a half years ago. We decided to have a conference to try to pull together anybody who had any information scientifically about it, but also to serve as a support system for people, because this is emotionally a very devastating illness, and people feel very much alone, and particularly when you're rejected by your doctors and people in your family do not support you because they think you're crazy. So we started this, and we started it in one of the local churches. We had about a half a day's worth of presentations, and that was the first year. From that time, we kind of gradually have grown. And for the last several years, it's been 2 full days at a hotel conference here in Austin. And we have had experts in a variety of different fields, infectious disease scientists doing research of all different types of scientists, and physicians, as well as physicians who are learning about Morgellons as well as Lyme disease and are treating it. So it has developed into an educational conference both for patients and to give patients support, but it is now a prime source of presenting the newest research and the newest information that we have about Morgellons disease. And we're far from understanding everything about it. We are beginning to get a good handle on what it is and what it is not. It is certainly not a psychiatric illness per se.
I totally agree with you there. So this is legitimately a grassroots effort comprised of professionals.
Comprised of volunteers. Several of us are professionals, some are not. So Cindy Casey's a nurse, I'm a physician. Several others who are volunteers or members of the board are just interested for one reason or another. However, the delightful thing is that we have been able to interest a number of very legitimate research scientists and physicians, and the information has it's exploded over the last few years. And quite seriously, I had no idea 10 years ago that we would be this far along at this point. I thought it would take much longer. Not that we're there, and not that we've finished to know everything about it, but we have a much more clear understanding. We had no understanding of it before.
Wow. Yeah, that's true. And a lot of the information that's out there just isn't accurate at all.
There's been a lot of stuff there's just so many misconceptions. I mean, I was looking at some of the comments on your website, and people are searching, and I don't know why people who have this disease seem uniformly to always be searching or trying to figure it out for themselves. And I guess that's the natural inclination one would have when your doctor tells you you're crazy, and you're pretty well sure you're not too crazy, at least. But we now have the factual background, the scientific evidence, and we have some reasonable and rational approaches to treatment. Clearly, it is associated with Lyme disease. The bacteria that causes Lyme disease has been cultured from the lesions of patients with this. But it's not just the lesions. It's not just Lyme disease. There are other bacterial and possibly other viruses and other organisms involved in a mixed infection in the sores. For example, the Lyme bacteria has been cultured in biopsy specimens from patients with Lyme disease and with Morgellons. However, when the lesions themselves are biopsied, there's a multiple organisms. Helicobacter pylori is one of the ones that was prominent. There are 3 or 4 others that are present both by bacterial cultures as well as PCR and other methods of identifying them. We've not found so far fungus being involved in it, although sometimes antifungals seem to help. And I can't say that fungals or other organisms are not involved. I'm just saying that we know so far a number of organisms are there, and we do know that treatment for Lyme disease tends to improve both the constitutional symptoms and in many of us, almost all actually who are treated aggressively, the skin lesions get better or even go completely away.
Now, you yourself are a Morgellons patient.
Yes, that's how I got interested in this.
So tell us a little bit about yourself, your background, and how long have you had Morgellons?
Well, I grew up in North Georgia and went to college and medical school and trained as a pediatrician, practiced in Gainesville, Georgia for about 28 years. And things were going just fine until 2004 when my wife at the time and I both developed these crazy skin lesions. And being very curious, of course, and being a physician and having no clue what was going on. The internet was, relatively new, at least to me, and we searched it out. And I think the thing that impressed me as much as anything is that as I searched through the internet, was the desperation of the patients. There were people who were having things that I think probably were Morgellons. There could be other things as well, but I think they were probably Morgellons, and they were using incredibly toxic methods of treatment. They were using insecticides on their skin as well as orally. They're using all sorts of other medications that they could obtain in various ways. And it was just so frustrating when I heard the stories of the people having been literally treated so poorly by physicians, dermatologists, emergency room doctors, family doctors. They pretty much assumed that people were crazy, that they were delusional, just based on a very cursory history and sometimes very little physical examination. That frustrated me terribly. And that's when I got online and started making contacts, and made contacts with several people who had Morgellons, got to know some of them over the phone and over the internet. We had joined Morgellons Research Foundation, which was a foundation at that time. We had some disagreements with it. We meaning Charles Holman, Cindy Casey, and myself. And we left that organization and founded what we call the New Morgellons Order at that time. And the choice was indeed made for a reason. And a couple years later, Charles Holman died, who was a best friend. And once he passed away, over time, we certainly continued this foundation, but we also have renamed it in his honor. And because he got interested, he was not a patient. He got interested in this because of his wife, Cindy Casey, who had the disease. And he swore that he was going to find a cure for this or he was going to die trying. Very sadly, he died trying. His work and his vision is going on, and we are gradually getting the word out both to physicians as well as to the public.
Wow, so Charles Holman actually did not have Morgellons disease.
No, he did not.
Oh.
That was a blessing as well, because in the early days when we were just beginning to find out about this, wife Judy and myself and Cindy, we were so sick that literally he would be the one who would drag everybody out to the car when we were going to go. For example, we went to a trip to Oklahoma to see Dr. Randy Wymore, and this was when we were just beginning to form the group, and a number of people met there. And Charles was responsible for getting us all moving and everything because we were all so fatigued. And literally, we could have stayed in the bed all day had we not had that help.
Wow. Sounds like he was a great guy.
He was one of the best friends I've ever had, and one of the best people I've ever known. He was deeply spiritual and just deeply committed to trying to help not just his wife and the other people that he knew, but everybody with this crazy disorder.
Dr. Smith, we know that serologic testing is often flawed, but do we have any kind of good marker for this disease? Are there any serologic tests which will prove effective?
Basically, no. There's a lot of different tests that are often helpful in the diagnosis of Lyme disease. They're not very good tests. The generally accepted ones that recommended by the CDC and are the first test are very, very poor. So there's better serological testing available. You have to seek it out, and you have to have a physician that will understand and will help you seek it out and get the right test, not just for Lyme disease, but also for the co-infections, because there's a number of other microorganisms. Some are bacteria, some are viruses, some are parasites who tend to inhabit the gut of the same ticks that carry Lyme disease. So having just Lyme disease without other infections is actually fairly uncommon. Babesiosis is one, is a parasite that's commonly associated. Anaplasma is one. Bartonella is very, very common, and some of the research people believe that it causes a lot of the fatigue and other symptoms that go along with it. The thing that is different about Morgellons is the presence of fibres, not just in the skin lesions, but fibres with magnification can be identified under intact skin.
Yeah.
It's not a scar, it's never been broken, and you can see it. Now, it takes probably between 50 and 100 times magnification and light, but that's not that hard to find in this day and age. I mean, you can get a microscope, a little handheld microscope to look at it, you know, for a few dollars, $10 to $15, and you can actually see these fibers. That's part of the confusion, is that how in the world are you having blue, black, white, and clear fibers in your skin? I mean, that makes no sense whatsoever to a logical, thoughtful person. However, this is the thing that seems to be absolutely across the board. The only thing that's diagnostic of Morgellons is the presence of these fibers. And we now know from research done by Marianne Middleveen that the body produces these fibers. They're keratin and collagen. The keratin is what makes up our outer skin layers, our nails and our hair, and collagen makes up the connective tissue of the body. And so these are produced by our body, these fibers, and it's really, truly bizarre. But it's the body's response to this mixed infection in the skin. Always involves Lyme disease, but also involves several other microorganisms that have been identified so far.
Is it mostly strange just because they appear to be textile fibers, they look like them, and you wouldn't expect those to be under the skin?
Been quite amusing that the dermatologists who have examined people and have actually looked at the skin with magnification have actually accused some patients of taking a syringe and injecting these fibers under the skin.
Jesus.
I mean, what kind of whack job would do that? I mean, yeah, maybe we're all crazy, and maybe but we're not delusional. And
That sounds like a fun weekend.
I don't know people that really want to make themselves sick, and the whole concept of injecting fibers under the skin, it's pretty out there.
Magical. So your experience with medicine, do you feel like it gave you a unique perspective going through this disease?
It totally gave me a perspective of. I was actually, when I was seen on one occasion in an emergency room, I was treated as if I was crazy, even though I was treated with an awful lot of respect because I'd been practicing in the community for 25 years. And I was well known. So that's the only reason I was not treated totally crazy, but boy, the looks and the implications were certainly there. And the psychiatrist was consulted. And as it turned out, the psychiatrist was personal friends who had been seeing as a psychiatrist for myself, off and on for several years. And after some more evaluation, he says, I don't know what's wrong, Greg, but I certainly don't think you're delusional, which is what the general consensus among dermatologists is. Those of us who have this have a delusional disorder.
Doesn't seem like there's a lot of justification there, particularly if they take out the magnifying glass and look.
That's been one of the most amazing things to me. Some years back, there was an association made with people who have this delusions of parasitosis. They would bring in specimens from their skin, if they'd scraped off or picked off or whatever. And some physician coined the term the Matchbook sign. And for whatever reason, it was thought to be diagnostic of delusional disorder. So that what happened and what has happened, and I have heard this from the mouth of so many different patients. I didn't believe it to start off with. I could not believe that physicians of any sort would do this. But these people would go in and give a history to the dermatologist, pull out their specimens that they wanted to look at. And that was just about the end of any thought process on the part of that physician. They immediately died from across the room now. Never examining this patient's skin will diagnose them as delusional. Now, delusional diagnosis is a diagnosis that really should be made by a psychiatrist, not by a dermatologist. And then they prescribe antipsychotics, which are very, very helpful to people who are psychotic and who are delusional, but they don't seem to do a whole lot of good for most patients with Morgellons.
Have you had, no, I'm sure you have, because, you know, just having Morgellons is a bad experience, but because of the condition, have you had some bad experiences in particular?
Well, the whole thing was pretty horrible. I think probably the worst part of it was that I was sick enough that I had to stop working. And after a year, it was obvious I was not going back to work anytime soon, and ended up formally retiring at that point in time. And was placed on disability eventually through Social Security and so forth. And I think the most profound thing that happened is that I lost my profession. I lost my job. That was hard. That was hard. But, you know, this was a while back, and there was no way I could have returned to work because my physical health was so bad. And it's actually only been in the last 4 or 5 years that I have been pretty healthy, because I did seek out a specialist in Lyme disease and got appropriate treatment with huge amounts of antibiotics for about 1.5 years almost. That improved me enough so that I could just tell I was much better. But it took about 4 years after that before I began to have more good days than I had bad days. And up until about 3 years ago, I would have to take 2 or 3 short naps during every day just because I would get so tired I need to go rest for a few minutes. I'm very blessed, though, that my health has continued to slowly improve to the point that now I have very few bad days. I really am able to do most of the things that I want to do. So I feel very, very blessed that, and I feel like I can be an example for people who are out there struggling. There is treatment for this, and if you cannot be cured, you can at least be improved dramatically. The problem is finding the right doctor, and that's got to be a doctor who knows about Lyme disease more than just the traditional information that most of us as doctors get. Because I have to admit, I was pitifully ignorant about Lyme disease during the time I was practicing, because according to the CDC, there's just very little, if any, Lyme disease in Georgia. And they kind of say that you can't get Lyme disease if you live in certain states. That seems a little strange to me, because that implies that people don't travel to other states, and that the deer have got a barrier there so that keeps them from going across the state lines. I mean, I don't understand that. But I feel very sorry that I didn't know better than that at the time, because I think there may have been patients that I had while I was practicing who may have had Lyme disease, and I was not able to recognize it. And I feel very bad about that. And I feel like just the state of knowledge and information about Lyme disease is the information that's out there is misleading, and I'm talking about the information coming from their experts, the CDC and the Infectious Disease Society of America. They consider at this point in time that Lyme disease is hard to get and easy to cure. And that's not the case at all. It is really a very difficult thing to diagnose, and it is not diagnosed by test. Lyme disease is a clinical diagnosis. You can't depend on some of the serological tests because most of those tests depend on picking up antibodies. And when your immune system is so suppressed by the infection that you're not producing appropriate antibodies, then your test will be negative. That doesn't mean you don't have the infection. It just means that your test is negative because your immune system is so overwhelmed that you're not kicking out enough antibodies for the test to pick it up. And that's why there are other tests that can be used, PCR, and other tests that I don't even really completely understand. But thank goodness the folks who are practicing as Lyme doctors really are using these tests and really helping them out as far as making the diagnosis and monitoring the treatment. And
yeah,
go ahead.
I was going to ask you, we know that Lyme is definitely easy to catch and hard to get rid of. But one thing that the experts have a concern about that is a valid concern is antibiotic use. Can't too much antibiotics hurt a person individually, or are there specific antibiotic protocols that are perfectly fine to take for long periods of time?
Well, it's a great question, and it's very much an individual thing. It's both an individual thing based on the patients and the patient's compliance and the physician and their knowledge and skill and expertise. It is perfectly safe to take large doses of antibiotics over long periods of time if you take the proper precautions and if you do the things to avoid complications. For example, probiotics and things to replace the gut bacteria that the antibiotics kill off are helpful. There's a variety of other things that people who are the experts in treating Lyme used to help stimulate the immune system, to help address certain of the symptoms and help the person, just basically get over this thing. And it's very complicated. I mean, it is where I think it's getting so complicated that the people who are doing it regularly have expertise that is so specialized that they are really the ones who you should go, because it is a very, very complicated disorder to treat, but it can be treated and it must be treated with antibiotics as well as other medications. But this can be done safely. It just has to be done carefully and monitored carefully, and the patient's got to be as compliant as possible, doing what the doc says, and you've got to have a good doc who's paying attention.
Yeah, you got to find one that you can trust and feel good about working with.
Yes, exactly. And a suggestion that I have is to look for what are called Lyme literate doctors, LLMDs, Lyme literate medical doctors. If the people on your viewership are not aware of it, they should be aware of ILADS. That's the International Lyme and Associated Diseases Symposium or whatever. I don't remember the last part. But anyway, you can find that online. They have some of the best information about the current research and current treatment. And I think if you have Morgellons, this is where you need to look, is the treatment is not just specifically for Morgellons. It's got to be for the underlying Lyme disease, because Morgellons is uniformly, in our experience so far, associated with Lyme disease.
Correct. And now, this condition in particular is disfiguring. I mean, it causes lesions on the body. And these are ulcerations, not lacerations, correct?
Correct. And they appear spontaneously. They're not just because the skin is itchy and people scratch it. They can appear in areas of the body where people can't even reach, and it would be impossible for them to scratch, but the lesions appear spontaneously.
And they're hyperpigmented and often last for several weeks, which is it's kind of hard to maintain a uniform lesion for weeks if you're just scratching it into your skin. How have you observed that this condition affects a patient's self-esteem?
Gee, when you have covered with sores, you are chronically fatigued to the point that you can't get up and go and do much of anything. And you have brain fog where you just don't think clearly. And you're just seriously like your head is in a fog. How can you feel very good about yourself? Because it's, you're chronically ill. You're in the bed. You can't do the normal activities that you've been doing in the past. So it can be pretty devastating emotionally.
And these patients kind of feel bad about themselves because the doctor's telling them there's nothing wrong with them. And
that I can't imagine anything worse than a person who is legitimately sick, going in to see a physician, and that doctor tells them that they're crazy. It's all in their head. That happens routinely to Morgellons patients. And one of the things that happens is that many patients will doctor shop. They're trying to find some help. And so it is held against them because they've seen so many different doctors, and the word in the community gets out. And once someone gets a reputation as being a delusional patient, local medical community, sadly, what seems to happen is that most of the docs just turn their brain off. There's a diagnosis there. This person's crazy. Well, obviously, you can't be sick. You're crazy. I have an interesting, cute little story that I will tell you that I think illustrates this so well. It's one of my favorite stories. I've told it many times. It's from my time in medical school. When I was first a junior medical student, which is when you're first beginning to see patients, there was a rotation in psychiatry. And one of the patients who came in was a regular patient. She was a lady who we would now call had a panic disorder. She had panic attacks, and her heart would beat rapidly, and she would become short of breath. And she was what is called a frequent flyer. She was in and out frequently because she'd come in, get stabilized on her medications, and then she'd go home. And after a week or two, she'd stop taking her medicines, and a few weeks later, she'd be back. And this had been a pattern. So she was back, and we got a call from the emergency room, part of the psychiatric institution, and she was sent up to the floor with her usual symptoms of shortness of breath, heart pounding, and anxiety. She saw the physician in that psychiatric emergency room. Then the psychiatric resident came and saw her. Then the attending physician came and saw her. And finally, the lowly medical student, not me, one of my friends, the lowly medical student went in. The medical student did something that the other three doctors failed to do. He did an actual, honest to goodness physical examination, because that's what you have to do when you're a medical student and what you should do for the rest of your career. However, that was neglected. And as it turns out, this lady was in serious congestive heart failure. After the junior medical student pointed this out, she was transferred to the CCU. Point is that people made assumptions, and they did not treat this patient as any patient should be treated. Every time a patient comes in, even if they have the exact same symptoms that they've had in the past, if you make an assumption that nothing has changed, then you are likely to be wrong at some point. And boy, were these folks wrong at that point in time. I've told that story many, many times because it just illustrates you shouldn't, in anything, but certainly not in medicine, you should not make assumptions.
Yeah, that's a serious failure right there.
Big time, big time.
Dr. Smith, is Morgellons associated with cigarette smoking and secondhand smoke?
There's not enough epidemiological research to say absolutely about what are all the different qualities and characteristics. However, there has very strongly been a large number of people who smoke who are included in the group. No idea why. No idea why. But the group does have a large number of smokers, more than the general population.
How about stimulant drugs? Now, are they in any way associated with the disease? And what I'm asking is, would a person develop Morgellons as a result of being on stimulant drugs, or can they develop Morgellons having never touched them?
Well, certainly the stimulant drugs can create sensations, particularly people who are abusing them. Meth, coke, crack. They call them coke bugs or meth bugs. And it is a delusional state that's brought on by the abuse of the amphetamines. It therefore is logical and reasonable that if a patient has Morgellons and then begins to take stimulants, it might make their symptoms worse. It might not, but it is not a cause. You know, it can cause the symptoms, but it cannot cause Morgellons. Morgellons is not psychiatric. It is a physical infectious illness. And yeah, you can impact symptoms with the stimulant drugs. Certainly any patient who presents with the symptoms of Morgellons as part of an evaluation should be evaluated for drug abuse. Just to, do drug screens to be sure that they're not having a delusional disorder because of the reaction to the stimulants, which can happen.
So, and when you say stimulants, that's not just street drugs. We're also talking about prescribed stimulants too, right?
Exactly, of course, yeah. Ritalin, for example, Adderall, benzodrine's not used very much. There's some other stimulants that are used primarily in attention deficit hyperactivity disorder in kids and in a few other conditions. As a pediatrician, I saw a lot of kids with ADHD and therefore have a lot of familiarity with it in that perspective. And I'm very respectful of them, but they also are very, very safe. Again, used with care by the physician and with good cooperation between the physician and the family, the patient.
So the stimulants don't cause the symptoms, but they will likely cause a patient to fixate on them.
Perhaps. That's a varied thing. It can vary from person to person and patient to patient. Certainly, if someone is abusing stimulants and taking high doses of them, certainly could cause the symptoms to get worse. Taking normal therapeutic doses, such as one might take for an ADHD or narcolepsy or some of those things, I don't know. I just don't know. I would guess that it would not impact. That's been my experience, but I can't say. I don't have enough experience to give any kind of definitive answer that I don't
Yeah,
think
each
so.
person is basically different, and every person needs an individual tailored treatment plan put together by a knowledgeable physician. Is that about right?
That is 100% correct, and particularly for treating something as complicated as Lyme disease, because it's not easy. It can. Every time I come to this conference, I hear some of these physicians who routinely treat patients and all the different things that they have to take into consideration and do, and the things that they do in addition to the antibiotics both help support this immune system, to help the patient feel better, to help address certain specific symptoms that the patient may be having, because there's a lot of anxiety and depression that's associated with this, just like it is with any chronic illness, and it's worse when you're not taken seriously by it. There was one of the presenters actually today talking about the fact that people have cancer. It brings their family together. They support them. They love them. They go to treatment centers where everything is explained in great detail to them, and they are treated with kindness and compassion. On the other hand, the exact opposite happens with patients who have Morgellons. Their family doesn't believe them because the doctors told them that they're crazy. They don't get the support from their family or friends, and they begin to feel very isolated. And it can be a downward spiral. And indeed, there's a fair number of suicides every year of patients with this because they have despair and feel like they can't get help.
Yeah, exactly. It's these patients are literally just trying to get help, and that's why they present the dermatologist with the box of artifacts, and then the dermatologist tells them they're crazy. Their family then ostracizes them, and nobody will employ them. It's you're right. It is a downward spiral that does often, unfortunately, lead to suicide.
Right. It really it's so sad that so far the medical profession has just not taken this as seriously as it should, because it's been so muddied by the amphetamine situation where people are taking stimulants and have symptoms like Morgellons, and with the delusional diagnosis, the delusions of parasitosis specifically. And actually, what was funny, the delusions of parasitosis, the original case definition did not include inanimate matter being there. It was only living insects, arthropods in your skin to be delusions of parasitosis. But recently, because they're now who have threads coming out, little fibers coming out of their skin, they've changed the name to delusional infestation. And it involves also having inanimate objects that you imagine are coming out of your skin. It fits the definition better for patients with Morgellons. Not that that's pretty sick, I think. Rather than helping the patients, they're doing the best to just cover it up and convince themselves and the patient that the patient's just crazy.
A lot of sometimes conditions and diseases aren't generally accepted until the scientific research comes in. I think autism was maybe contested, but as much as Morgellons is, can you imagine any disease that's as widely contested as this one?
Chronic fatigue syndrome, fibromyalgia. For a couple of quick examples, this is not an uncommon thing when you have disorders where the symptoms are not particularly specific to anything that we've known about before, or it's just something such as overwhelming fatigue and chronic, or the body pain that fibromyalgia patients have. Those were denied for many, many years. They're just now getting to be an acceptance of them. I'm hoping that in the next few years, that's going to be the case with Morgellons. Even though still to this day, there are a lot of physicians who don't believe in chronic fatigue syndrome and don't believe in fibromyalgia. But across the board in general medicine, it is being accepted. And I think that's going to happen with Morgellons. It's just taken a while. And I mean, it's shocking to me that when the research, which has been excellent research, has been presented to the dermatologist, they have dismissed it as no, it's fake. And it's some of the most best documented, significant research that I can recall reading. And it's certainly a whole lot more significant than some of the case reports and other papers that have been put out by dermatologists about Morgellons that really don't do any serious research or actually look at what the etiology of it is. They continue to try to prove that it's a mental disorder. Just
now, to be clear, you're talking about real scientific studies that have made it through a peer-reviewed process, which demonstrate this disease is associated every time just about with Borrelia bacteria. I say just about, but it literally is every time, isn't it?
Just about. Yep, that's correct. I mean, the data is there. That's what has blown me away, because about 2 or 3 years ago, this started coming in. The research was very, very clear there, looking for the Borrelia burgdorferi in the skin, in skin biopsy specimens, culturing for not just that, but for a variety of other organisms, and finding them, and finding these results consistently, patient to patient. And they were documented not just in 1 or 2 ways, but 3 or 4 different scientific methods. Every one of the steps was. And it was done. All of the stuff, and this is particularly Marianne Middleding and her associates' work, they did confirmation studies in a variety of reference labs. And the dermatologists and others who look at this say, no, makes no sense to me. I think if you have a fixed belief that cannot be changed by presenting evidence to the contrary, Well, actually, that's the definition of a delusional disorder.
Yeah.
We're thinking about delusions of doctors rather than delusions of parasitosis, because if you are unwilling to accept something that's right there in front of your face, because your belief system is so fixed, and even though there's evidence to the contrary, you don't accept it, well, that's, like I say, that's the definition of being delusional.
That's definitely a cognitive dissonance. And
most definitely.
To be sure,
it's insanity. It's total insanity.
Now they're not saying that the labs were faulty, because one of the studies actually used the Medical University of South Carolina down here to
among others. There were, I mean, the data's there. I read it. As a physician, you're trained to look at research papers and evaluate them critically, because there's a lot of BS out there, okay, that gets published, sometimes even in peer-reviewed journals. Frankly, I think there's some politics involved in that, but we won't even go there. Because there's politics in everything. But to totally deny that this research is valid and is decent, good research, that's pretty crazy. That's pretty insane. I mean, if somebody's crazy, it's to look at the evidence and say, no, it's not real. I don't understand that. But that is the situation.
It's not crazy if they can offer their own, idea of what's wrong with the evidence, but that doesn't seem to be the case. There's never really any.
Yes, they are sure. It is delusional disorder. It's a delusional disorder. That's all it is. They believe that, and they can present no evidence to the contrary, even though when they give that diagnosis, if you look it up in the Diagnostic and Statistical Manual, they're not following the steps, and they're actually diagnosing incorrectly. It's a delusional diagnosis. It should be made by a psychiatrist, don't you think? Yep. And yet dermatologists are making this diagnosis and treating people with potent antipsychotics. It's very frustrating. I think as a physician and as a patient, it's just very frustrating to see people who are closed-minded, who are respected members of their field, and they're closed-minded to information that's overwhelming, in my personal opinion. As a physician, it's overwhelming evidence, and they won't even look at it or accept it. It's cognitive dissonance for sure.
Dr. Smith, what about the skin test, the Borrelia skin test? Is this something that the general public has access to?
I don't think so. I don't know of any. I don't know of any specific. The type of test we were talking about were biopsy specimens they were doing very specific laboratory tests that are, they're not used as diagnostic tests in a diagnostic lab. They're used specifically to prove a point in a scientific research lab.
Oh.
So there's that would be something. Right now, the best advice I can give any person with Morgellons is to find a doctor that they can go to who will listen to them, and if they can make it, to see a Lyme literate doctor, a physician who has expertise in that. This can work very effectively. I saw a physician in Colorado, actually, Bill Harvey, who was an expert, one of the real early people who recognized how difficult Lyme disease was, and he was one of the ones who very early recognized that Morgellons was something strange here and real. And I saw him, and then he communicated with my personal physician at home in Georgia, and he would order the medications, and my physician would do whatever he needed to facilitate making sure that it happened. And a lot of good docs who are your general medical doctor you see are good people, and they will do stuff like that. I mean, you talk it over with them and see if they're receptive. And, most docs just want to try to help their patient. And if they don't understand something, and you've got somebody that's got information they don't have, well, gee whiz, I sure always wanted to get all the expertise I could, because you can't know everything. And if your patient's not doing well, you try to get somebody who can help them if you can't.
Yeah, sure. Well, now Morgellons, of course, being labeled a delusional disorder, It presents the possibility that the person with it is not being responsible for themselves. Delusional person scratching into themselves and just not taking care of their bodies. Does this put parents at risk of losing their children, just having the condition?
It's happened before. It's happened before. You know, I think it takes particular situations. Having been a pediatrician, I've certainly been involved with and aware of situations where children have to be removed. And I'm aware that this has happened to patients because of their Morgellons, and it would end up that they would lose their kids because they were seriously sick, but not crazy, but seriously sick. So that can happen, and I think it's a travesty of justice. It's wrong, but it has happened.
Yeah, that is tragic. Is there any way for a person to defend themselves in the instance this occurs?
First off, get a really good lawyer if you can afford one. But even more importantly, you know, make yourself knowledgeable about the disorder, and you know, get a psychiatrist. If they're going to take your kids away because you're crazy, then they got to provide a psychiatrist to prove it. I mean, and I would push for that you get a full psychiatric evaluation. Could help. You know, going through the legal system, it's complicated and it's difficult. But the one good thing from my experience as a pediatrician is that the court systems are not really interested in taking the kids away from the parents unless it is truly a situation that's dangerous for the kids. And if you can show that the situation is not dangerous for the kids, really the justice system has no real interest in taking the kids away other than to protect them.
Sure.
So that would be the best tactic, I think, is try to prove that you have a safe environment for the kids and that they are being properly cared for.
And if you have insurance, it probably wouldn't hurt, or regardless, it probably wouldn't hurt to have a working relationship with a psychologist, psychotherapist, or a psychiatrist even.
And certainly that would be incredibly helpful in that type of situation. It's helpful to have some type of mental health worker that you can talk to when you have any kind of serious, significant chronic illness, because you're going to get depressed and you're going to get anxious. I mean, that happens just because you're sick. Very normal, but it still needs to be addressed as part of dealing with the whole situation. And certainly if you have such a relationship, that person can testify for you in front of the judge in terms of a custody issue.
Exactly. Dr. Smith, I appreciate so much your time here today and helping us legitimize and further get the word out that there is legitimate and factual data around Morgellons disease. Do you see yourself moving beyond the disease? You said you've been well for the past couple of years.
I have moved beyond it. That's one of the wonderful messages that I want to give to the patients there. You know, there's life after this. It took a chunk of my life away from me. There are a number of years there that are more a blur than they are reality. And it it changed my life dramatically. I stopped doing the profession that I loved, and I still miss a degree because I loved it and it was fun and it was very rewarding. However, you know, I went through a grieving period, and I'm not going back to do that, but I'm retired. I'm feeling decent most days, and I have a great family and great friends. So yeah, there's life after Morgellons. Don't give up. It sucks. It's horrible. This disease, I just despise it for multiple reasons. But there's hope there, and we're getting there. If you can. So for everybody, if they're feeling desperate, get help. Emotional help, because too many people are dying from this, not from Morgellons. People are dying mostly from suicide. Most people who have Morgellons don't die from it, they die with it.
That's a powerful statement.
Well, that seems to be the observation. I cannot give that from my personal experience, but that's basically what I've heard from more than one of the Lyme physicians, that tends to be the case.
Dr. Smith, who can we direct people to get quality information and maybe get some help that they need?
As I've said, the ILADS website is excellent. There are individual state Lyme disease associations. For example, Texas has a Lyme disease association. A Google search for both the state organizations and the ILADS, and then look for the term Lyme literate medical doctors. Basically, these are physicians who treat this regularly. And I couldn't say how many there are now, but there are more and more physicians who are learning about this, figuring out what's going on. I mean, because it becomes pretty obvious, and then have decided, hey, I'm gonna try to help these people. So that's the good news, but it's gonna take a while, and there's still not that many physicians who treat it. So if you can have a relationship with a local physician and then see a physician who's treating Lyme disease wherever you have to go, and then be able to carry on telephone conversations and consultations with the expert doctor, and then having your local doctor help you by prescribing the medications locally. That worked very well for me, and I know others it's worked well for. If you've got the resources, of course, you do more. If you don't have the resources, you try your best to get the best information you can and try to present it to your doctor. Because if you've got a doctor who's sympathetic and will listen to you and will actually take some articles home and read them, that can be convincing, perhaps. I wish I could say, go do this and everybody can and you're going to get help. I can't. It's hard. There's just not that many docs who are willing to sign on to it. And sadly, I've found that there's too many doctors that just aren't interested and don't want to get involved in it. And I hate that. I think that's terrible. But it is the way it is. And the message is, yeah, it's going to be hard. Yeah, you got ahead of you if you're new with this disease, and if you're real sick with it, you got a ways to go. But there's plenty of hope out there, and I certainly feel very blessed that I've been able to pull through it. And I don't know what my health would have been like if I had not been sick, but for an old guy, I feel very, very happy that I'm doing as well as I'm doing.
Sounds like a good game plan too. Dr. Smith, thank you so much for your time, and thanks everybody for tuning. And check out what they got going over there. That's the Charles Holman Foundation website for Morgellons disease. And we look forward to seeing everybody again soon on our next episode. Bye, Dr. Smith.
Jeremy, thank you. Appreciate your help
And
helping all these people. God bless.